Hello and welcome to Mayo Clinic. My name is Dr. Craig Sawchuk and I'm a clinical psychologist and I work actually in the primary care practice. With being a clinical psychologist on the team, I work on learning different behavioral strategies that we can teach both our patients and our providers to managing common mental health conditions that we see in this setting. So what brought me to Mayo Clinic? Well, it's kind of an interesting story because it took me 3 times to get into this place. So that either sounds like I'm pathetic in some ways, or perhaps it's just the commitment to the model of care that they have. The first time I applied in 2006, the position wasn't quite the right fit overall. Another position opened up in 2008, which was just a perfect position, but unfortunately that one didn't work out because the economy crashed. So in 2012, another position opened up in primary care with a specialty expertise in anxiety disorders, which was an absolute perfect fit. Now, like I mentioned, it sounds a little pathetic applying 3 times to get into a place, but there's honestly no better place on the planet than to be a healthcare provider than here at Mayo Clinic. Another thing that actually really keeps me here at Mayo, beyond that I just love it, is that we always have that chance to innovate. The great thing about our line of work and being in mental health is we're never going to figure it out. We're never going to have all the answers. And that's what's cool. And that's what makes doing this kind of work really engaging and really interesting. So coming to Mayo Clinic, we're never going to be bored either during our training or our entire careers here at Mayo. One of the teaching philosophies that I take is it's really experiential learning. One of the things that I've really had the pleasure on working with the psychiatry residency training program is in our 3rd year is working on developing a cognitive behavioral therapy psychotherapy course. So we meet on usually on Tuesdays for about an hour for several weeks, and we really get more of a deep dive in terms of what's the nature of cognitive behavioral therapy, what are different practical strategies that we can do as providers to help engage our patients, but then really learn these evidence-based treatment principles that are really, really good to know as a provider, not only in your training, but really in your career. I also work with the clinical health psychology program, so I work with my other colleagues here in the training program, and one of the areas that I direct is our primary care training track. So every year we have our fellows come in either for a major rotation or a minor rotation in our primary care services. And honestly, as a psychologist, we just want our trainees to jump right in to the rhythm and flow of primary care practice. Now, for some of our applicants that come in, some folks have actually already had primary care training experiences, whether it be on internship or even in graduate school, but there's plenty of our folks that come in that have never had any experience in primary care. So some of the issues that we work on in primary care are learning how to implement population-based treatment models to common mental health conditions. So we look at that not every patient that we see needs one-to-one, face-to-face therapy. There's lots of low-intensity things that we can work on with folks, like self-help, education, or even directing the intervention towards the primary care team. But we also want to be good air traffic controllers and help work with our primary care practice to identify those patients who maybe need a higher step level of care and how can we best connect them with those treatment options. In working in this rotation, you'd also be working with a multidisciplinary team. So we have in our division, which is called Integrated Behavioral Health, we also have psychiatric prescribers, nurse care coordinators, and social workers, and we all work together, again, with this common mission of providing the best possible care that we can to our patients, but again, leveraging everybody's skill sets in a different way. One of the key things for psychology fellows by the time they arrive to us on fellowship is they have been supervised to death. I mean, they have tons and tons of experience in teaching and training in evidence-based assessment and intervention approaches. So that's a real great skill set that we want to work and develop with folks during their primary care rotation. We have a number of case consultations and formal and informal training opportunities for other mental health care providers across our integrated behavioral health programs, and other primary care teams where our psychology fellows can really play a key role in helping to teach and train those groups of people in evidence-based practices. So we really look forward to having folks join us in our primary care practice. They're not only great clinical opportunities, they're great educational opportunities, and we also have a number of other research projects constantly going on in our integrated behavioral health program that our psychology fellows are more than welcome to join us over the course of their 2 years.